Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, returning to the show is one of the most popular guests from this past season. We got so much positive feedback, even from people who disagree with me or disagree with him, that we just had to do a sequel. And with so much change in the BC political landscape, so much change since I last spoke to our guest tonight back in February, what better time than now? Here for the entire program, a former BC Minister of Aboriginal Relations and Reconciliation, he has sat in the BC legislature for 2 decades representing the Chaco Lakes, the leader of the Conservative Party of BC, backed by popular demand. He is John Rustad. John, what an honor. Thanks for being back.
Thank you for having me on.
You've been on fire lately. Your party is polling at all-time highs. You've got BC United MLAs crossing over 2 in the past week. Are you tired of all the winning?
Well, we have a long way to go. Look, I mean, at the end of the day, the only poll that matters is going to be the poll on election night, right, on October 19th.
Yeah, fair enough.
But we're building a lot of momentum. We're having people joining us right across this province. People are very excited about us bringing change to BC. And so it's been quite a journey so far, but like I say, there's still a long way to go yet.
I want to set the record straight on something. Recently, there was a lot of talk about the BC Conservatives, your party, merging with BC United, whose leader is Kevin Falcon. We know that that's not on the table anymore. That's not happening. There's no cooperation. But you told a story about back in December, someone from your team had approached Kevin Falcon with this idea of cooperating for the October election. And according to you, Kevin gave a very curt response. He said, "F off." And I'm just curious, was this in text? Was this an email? To explain how this all went down.
So first of all, between Kevin and I, we actually have had very little communications.
Okay.
Once in a while, we run into each other at events. Obviously, we're running in a lot of the same circles. And we'll say hi to each other and be courteous. He did send me a text message actually back, I think it was in February, which was, 2022 was a pretty tough year for my family and I. Lost my dad, my father-in-law, and my mom. And he sent a note saying, "I'm so sorry, I heard about it. I just heard about it. Sorry I didn't send a note before." So he sent me that note.
And you were still with the BC Liberals?
No, that was just this past February.
Oh, okay. I thought you said 2022.
Yeah, no, when 2022 is when my family, my parents had passed away.
Understood.
So, however, before Christmas, there was some discussion as to whether or not we should try to work something out with the United Party. And so we did ask some people to reach out to Kevin's people. At least one of the people, perhaps more, had texted Kevin directly, and that's where the response came in.
Okay, so it was someone from your team texting Kevin directly, and
Correct.
That was Kevin's response, not one of his staffers' response.
Correct.
Okay, now he's saying that this never happened. He's basically called you a liar. He said this didn't happen. Why don't you just make this public? Because even his staffers are saying that you promised to show proof to the media. Yeah. You don't necessarily have to post on Twitter, but you could show people in the media and say, hey, this happened. Why not do that just to prove yourself right?
So first of all, listen to what Kevin says. Kevin says he never texted me.
Okay.
He didn't say he didn't text somebody else.
You think he's being a little sneaky with the words?
He is.
Okay.
Of course he is. He does that on a regular basis.
Okay.
That's one of the reasons why, as the Conservative Party of British Columbia, I just try to be straight up with people. I don't try to play those games. I mean, political parties operate in the shadows. They don't want you to have facts because then they can spin. This is one of the things we need to change, but perhaps we can get into that another time.
Sure.
So with regards to why not put the text out there, I want to be able to protect the identity of the individual that was involved because there's other issues at play as well. And so that's why I've decided not to put that information out and make it public.
Okay, fair enough. I have to ask you, though, how much of this is personal between you and Kevin? Because when he kicked you out of the BC Liberal caucus at the time, he said that you're not trustworthy. He said that you aren't a team player. He actually booted you out on your birthday. So I'm just curious, does this kind of transcend politics, where is this personal rivalry between
I have no ill feelings towards Kevin. I don't like his leadership style, and clearly the people in BC are not keen on his leadership style either. But having said that, there's no hard feelings between Kevin and I, or at least certainly on my side.
Okay.
I don't know if there's anything on his side. You'll have to ask him. And I worked with Kevin from 2005 to 2013. Right, I was part of that party for over 20 years, 22 years almost. Mm-hmm. And so I've got lots of friends, at least some friends that people that I still say hi to with, and occasionally go out for a drink or a meal with on that side. So to me, it's not personal. To me, this is about what we need to do for British Columbia. It's the whole reason why I actually started doing what I'm doing, because when I was kicked out, I started thinking about it and thought, well, if Kevin Falcon can't win, and we need to bring an end to these sort of radical policies that David Eby is bringing in, we're going to be here in 2028 having this conversation. And so I started thinking about it and thought, no, you know what? We need to be able to bring change in BC. Clearly, if the existing party can't do it, then we need another option. And that's what ultimately got me thinking about doing what I'm doing. And it's really, it's only been just over a year since I actually joined the Conservative Party and took on the leadership.
Sure. And you've been quite a force. Now, really quickly, hypothetical scenario, let's say Kevin Falcon folds BC United and then approaches you and says, can I run in one of your open ridings as a BC Conservative candidate? You would still be the leader. Would that be something that you would entertain?
So I have said publicly all along that we're open to anybody who would like to come and be part of the Conservative movement that we have in this province, bringing about common sense change in BC. And so if anybody is interested in having that, we're willing to have that conversation.
Including Kevin Falcon?
Kevin Falcon or anyone. Okay. I mean, like I say, I've got no hard feelings towards Kevin. Kevin was an effective number 2 person for Gordon Campbell. He got some things done. Like I say, I don't particularly think his leadership skills are very strong, but that's a different issue. But I'm looking for anybody that wants to be part of our movement that is going to be able to help us to be able to defeat the NDP and without compromising who we are and the principles that we stand for.
Well, I can appreciate that. We have to take a quick commercial break. Once we're back, let's talk about some policy and let's talk about healthcare.
Sounds good.
Welcome back to This is VANCOLOUR. We're back with the leader of the Conservative Party of BC, very possibly the next premier of this province, John Rustad. And this conversation is brought to you by Pacific Sands Beach Resort in Tofino, laid-back luxury, as beachfront as it gets. So, John, you have very correctly pointed out that BC is the only jurisdiction in North America where healthcare workers that had to leave their job basically because of the COVID-19 vaccine mandate have not been brought back, have not been allowed to come back to work. You've gone a step further, though, and you've said that you would actually like to compensate those workers for lost wages. Am I right? Is that your current position?
So certainly when you look at the mandates, they've been dropped everywhere else. I don't think there's any place in the world that still has mandates other than British Columbia. And so when you look at it and think, okay, exactly what science are we following that other jurisdictions aren't? And we have a crisis in our healthcare system.
We have a nurses shortage.
We have a nurse shortage. We've got a doctor shortage. We've got ERs that are emergency rooms that are on diversion. We've got all kinds of things that are problems are going on. The reality is we need everybody we can working in the system. And so we need to be looking at hiring people back and getting them back in the system. But I also think that, given that we are the only jurisdiction that hasn't done this, I think there's a wrong that's been done. And so we need to look at that wrong and see how we correct it. And so what my proposal is, we're going to put a group of people together to look at it in terms of what can be done. For some people, that may vary depending on their circumstances, but that's what I want to look at doing because I want to be able to treat people fairly.
When you originally brought up this idea, though, you said compensation for lost wages.
Yes.
So it's not a signing bonus to come back. It is representing the wages they lost. Is that right?
Correct. It's compensation for the time that they were that they've been off, right?
Okay.
And so, like I say, there's different circumstances for different people, but I want to look at it and see what we can put on the table that will be fair. I
guess where I'm just curious is there's about 2,500 healthcare workers that basically lost their jobs because of the vaccine mandate. If we conservatively estimate $100,000 worth of lost wages, again, this is over multiple years, so I think $100,000 per worker is somewhat conservative. That's $250 million. Do you think taxpayers actually want to pay $250 million in terms of lost wages to these workers?
So certainly that's a big number when you look at it from that perspective. Some of those people, of course, have been retired. Some of those people have gone on. But my perspective is you talk to somebody who can't get into emergency because of diversion. You talk to somebody that desperately needs a service and it's not available. I've got a nurse in my riding that's trying to help people with home care and is in tears because there isn't the people there to be able to provide the services. And she has to say, I'm sorry, I can't help you. So we'll talk to them about what type of investment we need to do in this province to make sure that we can deliver proper health care.
Fair enough. Now, recently you told the Globe and Mail that you want to increase privatized healthcare clinics. You actually pointed out that the BC NDP has already been doing a little bit of this and you would want to do a little more of this. So Where I'm curious is, are you committing to giving more public funds to privatized healthcare clinics?
There's only one jurisdiction in the world that comes close to following the healthcare model that we have, and that's North Korea. And I'm sorry, that's not a very good model to be thinking about.
Is that a fair comparison, though?
You do the math. Go ahead and look at the healthcare models around the world. It's the only one that comes close to following our model. And so I look at it and I think, so wait a second, if we have other models in the world that are universal healthcare, that's available to everybody, that are getting much better results than ours, that have shorter wait times, that are able to have more on-demand services, why wouldn't we want to do that? Why are we sticking with a system that's not working? Clearly, we're in a crisis. And so my perspective on this is, let's look at these other models. And when you look particularly at the European models, whether it's the Scandinavian models or in other countries in Europe, even Australia, when you look at these models, it's universal healthcare, it's a single payer, but they have it delivered by both public and private. And I'll give you the example of one of the doctors I talked to. He's a surgeon, and no longer he's left the system. But he was getting 8 hours of surgery time a week. That was all he was allowed to do in the system. He could very easily be doing 20, 30, or 40 hours a week. So why aren't we utilizing these professionals we have to be able to provide these services instead of have these massive long wait lists? I mean, the amount of wait time has increased by over 200% since 1993. Like, in my perspective, the healthcare should be focused on delivering services for people, not on supporting the system itself. It has to be about the patients. And I don't care how it's delivered, as long as it's delivered timely and we start actually getting on a better path for our healthcare system.
And I think that's fair, but how do you sell it to British Columbians? Because basically what you're saying is that taxpayer money will subsidize the profits of private healthcare systems, which I think makes a lot of people feel uncomfortable.
Well, once again, if you need a hip replacement, do you really care who's getting that placement? Or where are you getting it from?
We can't increase capacity in the current system?
Well, clearly we're not. We've got the second most expensive system in the world on a per capita basis, and we have some of the worst wait times in the world. We're ranked like 28th or 29th out of 30. And so clearly we're not delivering what should be delivered. And I'll give you a story that a friend I know tragically passed away, and she needed a hip replacement, and she was on a waiting list. And she was waiting for it. She couldn't sleep. She was uncomfortable. She was on her way down to Vancouver, and she fell asleep at the wheel and died.
Wow.
I mean, this is what I mean by, does it really matter where that's coming from? When you need the service, you want to be able to get the service. Yeah. And we should be focused on the patient, not on a system that is failing.
On the topic of healthcare, do you see drug use or substance use disorder as a criminal justice issue or as a healthcare issue?
No, I see it as a healthcare issue. But what I do see is there is obviously a criminal component in terms of dealers and the drugs that are making their way to the streets. I mean, so this decriminalization effort that's been going on and safe supply that Bonnie Henry was just last week out in Ottawa doubling down on their policy and approaches and wanting to expand the programs in BC. They've been clearly a failure. We'll never get back to the place, and I never want to get back to the place where you're arresting somebody for simple use or possession. That's crazy. But I do want to be able to make sure the police have the tools to keep people safe. I mean, right now you've got people going into a hospital doing drugs, and the police can't do anything about it. You've got people doing drugs in a playground beside kids, and the police can't do anything about it.
I mean, those are still technically illegal, right? Like, it's not that that's legalized. It might be happening.
It's decriminalized, and so it's happening because the police have no way to be able to do anything about it. So the other one, though, the police tell me this: if you've got a dealer or a suspected dealer, and you've got cars coming and going from a house, the police can no longer stop a car and seize the drugs and use it as evidence to go after the dealer.
Why can't they just go to the house if that's where the drugs are coming from?
Because you need to build the evidence to get your search warrant.
Okay.
And if you can't do that, then they can't go after the individual.
I guess I'm slightly uncomfortable with this idea that you are now, by ending decriminalization, you are giving police the authority to arrest, charge, criminalize simple drug possession or simple drug use. That's going to deter people from accessing healthcare. That's going to deter people from safe consumption sites. Like, how does that help the drug crisis, or how does that keep people alive?
We haven't been doing that for 30 years.
Right, but they still would have the authority on the books.
Sorry, they have the authority in the books, but they had the authority on for the last 30 years and haven't been doing it. Nothing's going to change on that side. What needs to happen, for example, there's a housing project in Victoria, and it's a supportive housing. It's for people that are hard to house, and there's a society that is running it, and they have a separate room for smoking fentanyl. Then they've got another separate room for smoking crack. And these people, of course, go in there, they get high, then they come out into the common area and they're still smoking. So the workers there actually went to WorkSafe and said, this is an unsafe environment. Can we stop this? And WorkSafe said, well, you'll have to wear a gas mask. Like, I'm sorry, this sort of nonsense has got to come to an end. We've got to get to a place. But the idea in particular of things like safe injection sites, those will still exist, but we want to turn them into recovery intake sites to link people to recovery. At that same housing project that I told you about, we had some of the workers would put up a sign, just information how to get into recovery. That sign would be taken down. They're not allowed to put it up. And a matter of fact, a worker actually was suspended for a day because they might be making somebody uncomfortable. We've seemed to have stopped caring about trying to get people into recovery. And we certainly don't have the capacity or space either. This is what needs to change.
But do you think if we recriminalize drug use, and really quickly, sorry, we have about a minute left. Do you think if we recriminalize drug use, it's actually going to lead to people not having an incentive to go to safe injection sites where they may be connected to health care services, including recovery and treatment?
That won't change in terms of those sort of services. But it will do is it'll make sure that if somebody's sitting in your doorstep and they're doing drugs, you can actually call the police and they actually have something they can do about it. They can actually, say, no, you can't do this, move along, this is illegal. We're not going to be arresting them and filling our jails. That we haven't done that for ages. But it's a tool now that the police can use to make sure that we can have a civil society, make sure that these sort of things are not going on, that children aren't being put at risk, and you have safe work sites.
Well, we'll have to leave it at that. But when we're back from commercial, we have to talk about some things that Premier David Eby has said about you. Folks, don't go away because John Rustad will still be here. Thank you so much to Pacific Sands Beach Resort in Tofino for supporting local conversations. Now, after some business, critics have slammed the BC Conservatives for harboring homophobic and anti-LGBTQ views. We'll let the party leader answer those concerns up next. Welcome back to This is VANCOLOUR. We're here with the leader of the BC Conservatives, a guy that's rolling into the summer ahead of October's provincial election with all the momentum. He is, of course, John Rustad. John, thanks so much for sticking around.
Once again, thanks for having me on.
Absolutely. So BC Premier David Eby recently said that homophobia, transphobia, anti-LGBTQ sentiment basically runs throughout your party. I'd like to give you a chance to respond to that allegation.
Well, David Eby is going to say all kinds of things and make up all kinds of stories because he's desperate in politics to hide his failed policies and the disaster that is now in British Columbia with all the crises. So I get it. He's going to play politics with all that kind of stuff. But I would strongly disagree with that sort of perspective from him.
But you've had a candidate resign over a very storied history of homophobic, transphobic tweets. You have a regional director in your party who's also running in Vancouver Point Grey against David Eby, who called one of your now new candidates, Eleanor Sturko, called her a woke lesbian in a very derisive way, said she was a groomer, or maybe was referring to Kevin Falcon as a groomer. So how can you say that you don't harbor those views when you have candidates still active in your party that have said things like that?
Well, first of all, we're really pleased to have Eleanor come over and join us. She's a strong individual. She fights very hard for the things that she believes in. And I can tell you, she had a conversation with Paul about that. And they got along well in terms of it. Paul apologized for those sort of comments. You get sort of comments that will happen during by-elections or elections, right? You get that sort of fight that goes on back and forth. But I don't believe that's that in his personality whatsoever.
But on a larger scale, is it not just about Eleanor? And that's up to Eleanor to accept the apology. That's totally fine. But when someone tweets like that so publicly and says those things publicly, I mean, doesn't it affect the affected community?
Well, it was about an individual. It wasn't a branding of
But using slurs is offensive to the entire community, isn't it?
Well, David Eby's used lots of slurs against me too. So what's the difference?
What has he said about being a slur?
Well, I would think just many of the comments he had, particularly even comments in the House in terms of how he's attacked me, very much following the democratic style in the States. He seems to want to introduce that into British Columbia.
But are they derogatory in the same way that calling someone a groomer is?
That's that sort of language you'll have to ask somebody else about, not me. But I do look at it from perspective of David Eby's getting personal.
Okay.
And what's the difference when you're getting personal?
Okay, sure. I guess I'm just seeing a difference between calling someone just a name and calling someone a derogatory name.
Yeah.
You don't agree that there's a difference?
What I do know when I look at our party and when I look at the things that we're doing, we've got people from right across this political spectrum. We've got people who are part of the LGBTQ community that are part of us, that are running as candidates and part of our team. So I look at that and I think when I hear those sort of statements, I just shrug it off because I know that's not true. It's not who we are as a party.
Okay. June is Pride Month, so can we expect you and the Conservative Party of BC to be celebrating festivities throughout the province and I guess throughout the whole summer in an official capacity?
So, for example, we had one of our candidates just this past weekend, I think, or just the other day, out in a Pride parade in Penticton. And so it'll be up to candidates in terms of whether they want to participate or not. It's completely up to them.
Will Paul Ratchford be participating in the Vancouver Pride Parade?
That's somebody you'll have to ask Paul Ratchford about. It's certainly not. I'm not going to be.
He's a candidate in Vancouver,
but I'm not going to be saying it's mandatory for candidates to do. If they want to do it, if they're comfortable, great. If they don't want to do it, that's completely up to them.
Okay, I'm just hearing that on a party organizational level, you're not organizing this. You're not saying that, hey, we have to show a presence at these events.
That's completely up to the candidates, just like it is for candidates that want to celebrate other sort of things that are going on throughout the year.
Okay. Mr. Rustad, always a pleasure to chat with you. I hope we can do it again in the fall.
I hope so too. Matter of fact, the fall should be quite interesting. We'll see whether or not David Eby actually drops the writ to have an election, because he could potentially go 5 years. But however, it's
how
that's the
you're leaving me with that meatball. How can he go 5 years?
That is our constitution in the province. You have up to a maximum of 5 years to drop the writ. And
wow.
So we've got a preset election dates, but we've already seen that the NDP don't really care about that. So we'll see whether he drops the writ or not. I'm anticipating is. He hasn't given any indication that he won't. And certainly we're going to be fully prepared to fight the election come this fall, but you never know.
That is a wild statement to leave me on. John, thank you so much for your time tonight.
Thanks for having me on.
Folks, that's our show. Thank you so much to BC Conservative leader John Rustad for his time tonight. I suspect it won't be the last time that you'll see him on this program. As always, shoot me an email with your thoughts, mo@thisisvancolour.com. Also, please follow me on X or TikTok @VanColour. We will be back next week, but for now, this is VANCOLOUR, and I'm Mo Amir telling you that in a province where you can be anything, be colorful. Peace.